A 2020 Cochrane review, the gold standard in medical evidence, found that pelvic floor muscle training cures or significantly improves stress urinary incontinence in 74% of women. 74%. No pill achieves that. No surgery is needed. The exercise takes 2 minutes per session, 3 times per day. It requires no equipment. You can do it sitting in your kitchen chair right now. And yet, 8 out of 10 women who try pelvic floor exercises, commonly called Kegels, do them wrong. They squeeze the wrong muscles. They hold for the wrong duration. They give up after 2 weeks because they see no results. The exercise works. The instruction has failed. I'm Dr. Rosalind Keller. 36 years in family medicine. I don't sell supplements. I don't run a clinic anymore. I'm here because someone should tell you what your doctor doesn't have time to. Your doctor said do Kegels. You nodded. You went home. You squeezed something. You were not sure what. Maybe your belly tightened. Maybe your thighs clamped together. Maybe you held your breath. You did this for a week or two while watching television. Nothing changed. You still leaked when you coughed. You still wore a pad every day. You assumed the exercises did not work for you. You never mentioned them again. But the truth is, you were probably exercising the wrong muscles entirely. That is not your fault. Nobody showed you. Nobody guided you. Your doctor said 2 words, do Kegels, and expected you to figure out the rest. That is like handing someone a violin and saying, play Mozart. The myth is that Kegels are simple and self-explanatory. They are not. The pelvic floor is a group of muscles that most people cannot see, cannot feel clearly, and have never been taught to isolate. Research consistently shows that up to 80% of women who attempt Kegels without professional instruction do them incorrectly. The most common error is bearing down instead of lifting up. This pushes the pelvic floor downward, which is the opposite of what you need. The second most common error is engaging the abdominals, buttocks, or inner thighs instead of the pelvic floor. You feel like you are working hard, but the right muscles are not firing at all. Here is what your pelvic floor does and how to find it. Your pelvic floor is a sling of muscles running from your pubic bone in front to your tailbone in back. It supports your bladder, your uterus, and your rectum. When it contracts, it lifts these organs upward and squeezes the urethra and rectum shut. When it relaxes, it allows urination and bowel movements. The easiest way to identify the correct muscles is this. Imagine you are sitting in a movie theater and you suddenly need to pass gas. Squeeze the muscles you would use to hold that gas in. That lifting, closing sensation is your pelvic floor. If you feel your buttocks clenching, your thighs squeezing, or your belly pushing out, you are using the wrong muscles. The pelvic floor contraction should feel internal, not external. Nothing visible should move. Before we go further, I need you to hear this. If you have any of the following, stop and call your doctor before changing anything I described today. Kidney disease of any stage, liver disease or cirrhosis, diabetes treated with insulin. You take blood thinners like Eliquis or warfarin. You take a diuretic. You take a proton pump inhibitor like omeprazole. You have uncontrolled high blood pressure. This video is education. It is not personal medical advice. Nothing replaces a doctor who knows your chart. Now, with that said, here is what the research shows. I want to tell you about Jean. Jean was 71 years old, retired nurse from Orlando, Florida. Jean leaked every time she coughed, sneezed, or laughed. She had been doing what she thought were Kegels for 3 years. Nothing improved. She wore pads daily. She avoided exercise classes. She stopped traveling because airports made her anxious about leaking during the flight. When Jean came to see me, I asked her to demonstrate a Kegel. She squeezed her abdomen, held her breath, and clenched her buttocks. All three are wrong. She was bearing down on her pelvic floor instead of lifting it. For 3 years, Jean had been making her problem worse while thinking she was fixing it. I spent 10 minutes teaching Jean the correct technique. I had her lie on her back with her knees bent. I told her to relax her belly, breathe normally, and imagine she was trying to stop the flow of urine and hold gas at the same time. Lift, not push. She felt a subtle internal lift. That was the first time in 3 years she had engaged the correct muscles. We built a program from that moment. Here is your first test. Sit in a chair with your feet flat on the floor. Place one hand on your lower belly. Now try to contract your pelvic floor. Lift and squeeze as if stopping urine and gas simultaneously. If your hand on your belly feels your abdomen pushing outward, you are bearing down. Wrong direction. If your hand stays still and you feel an internal lifting sensation between your legs, you are doing it correctly. Practice this until you can contract without any belly movement. This isolation is the key. Without it, the exercise will not work. Here is your second test. While urinating, try to stop the flow midstream. If you can stop it completely for 2 to 3 seconds, your pelvic floor has baseline strength. If you can slow the flow but not stop it, your pelvic floor is weak but functional. If you cannot affect the flow at all, your pelvic floor is very weak, and you should consider seeing a pelvic floor physical therapist. Important: do not use this as a regular exercise. Stopping urine midstream regularly can cause urinary tract issues. Use it once as a diagnostic, and then do your Kegels separately. Things that undermine pelvic floor training. First, holding your breath during the squeeze. Holding your breath increases abdominal pressure, which pushes down on the pelvic floor. Breathe normally throughout. Second, doing too many repetitions too fast. Quick, shallow squeezes build endurance but not strength. You need both slow holds and quick contractions. Third, not progressing the difficulty. Doing 10-week squeezes forever is like lifting the same 2-pound weight for years. You need to increase the hold time and the number of repetitions as your muscles get stronger. Fourth, only doing Kegels lying down. You leak while standing, coughing, and moving. Your pelvic floor needs to work in those positions. Practice Kegels sitting, standing, and eventually during movement. Here is the correct technique and the exact protocol that works. The exercise has 2 parts: slow holds for strength and quick flicks for reflexive response. Part 1, slow holds. Squeeze your pelvic floor and lift upward. Hold for 5 seconds. Release for 5 seconds. Repeat 10 times. This builds the sustained strength needed to support your bladder during prolonged standing or walking. Part 2, quick flicks. Squeeze as hard and fast as you can for 1 second. Release for 1 second. Repeat 10 times. This builds the rapid contraction you need to catch a cough or sneeze before leaking. Do both parts 3 times per day, morning, afternoon, and evening. Total time per session, approximately 2 minutes. Total daily investment, 6 minutes. That is it. Here is the progression schedule. Weeks 1 to 2. Hold for 3 seconds, 8 repetitions plus 8 quick flicks. Weeks 3 to 4. Hold for 5 seconds, 10 repetitions plus 10 quick flicks. Weeks 5 to 6. Hold for 7 seconds, 10 repetitions plus 12 quick flicks. Weeks 7 to 8. Hold for 10 seconds, 12 repetitions plus 15 quick flicks. Add the knack technique starting week 3. Before every cough, sneeze, or lift, deliberately squeeze your pelvic floor 1 second before. This pre-bracing prevents the leak. Within 6 to 8 weeks of consistent daily practice with proper technique, most women see measurable improvement. This is the Keller pelvic floor protocol. Step 1. Learn the correct contraction today using the belly hand test. If your belly moves, you are doing it wrong. Practice isolation until you can squeeze without any external movement. Step 2. Follow the 8-week progression schedule. 3 sessions per day, 2 minutes each. Set phone alarms for morning, afternoon, and evening. Step 3. Learn the knack. 1 second before a cough, sneeze, or lift, squeeze your pelvic floor. Practice this deliberately until it becomes automatic. This single technique eliminates leaking in up to 70% of mild cases. Jean followed this protocol exactly. She set 3 daily alarms on her phone. She did not miss a session for 8 weeks. At week 3, she learned the knack and started pre-bracing before every cough. At week 4, she noticed her first improvement. She coughed during a phone call and did not leak. She almost cried. By week 8, her daily pad use dropped from 3 to 1, and many days she did not need it at all. At 12 weeks, Jean went back to her exercise class. She went on a trip to visit her grandchildren. She told me that 6 minutes a day gave her back everything the leak had taken away. Write your age below. And tell me, have you tried Kegels before? Did anyone actually teach you the right technique? I read every comment. Here are your 5 takeaways. 1. 80% of women do Kegels wrong because nobody teaches the correct technique. 2. Place your hand on your belly. If it moves, you are squeezing the wrong muscles. 3. Do 10 slow holds plus 10 quick flicks 3 times daily. 4. Learn the knack. Squeeze 1 second before every cough or sneeze. 5. Follow the 8-week progression and expect results starting at week 3 to 4. This is the conversation your appointment never had time for. The question you wrote down and then crossed out in the waiting room. I don't sell anything. I don't have a practice. I profit from you not needing me. You deserve answers without embarrassment. I'll see you in the next one.